huge tragedy. In the future, the medical graduates in Sri Lanka are going to lose their government jobs.
How is that possible? Everybody says there still aren't enough doctors in hospitals.
Well, that is exactly the problem. You see, after completing their internship, doctors work as RHOs, residential house officers, until they receive a permanent appointment.
Yes, hospitals are practically run by them, aren't they?
But now, the Ministry of Health is saying that they cannot accept them as government medical staff.
Are they just trying to not give these people jobs after they have gone through a grueling internship and 5 years of medical training and a medical degree?
Exactly. What they are planning is to only recruit a very limited number of doctors.
But then again, the ministry says that there aren't enough vacancies in hospitals, right?
That is a complete lie. The ministry is still using old employee data from 2015.
Wait, they're using 11-year-old statistics to make decisions that will impact the future?
Absolutely. There has been no single cadre revision after 2015.
So, are they trying to cover up a shortage that exists? This one story that I heard, there was a hospital in Nicaragua, yes, where only one doctor is working where there needs to be at least 8.
Absolutely. There is a very significant shortage, and not just doctors, in every sector, including nursing, supplementary, and minor staff.
So, why do they keep telling us that there are no vacancies?
Well, the government isn't expanding the public services because of IMF conditions. The General Treasury has restricted the allocation of funds to the health sector.
Okay, now this means they're bringing up the very false argument that there are no vacancies left simply because they're not willing to allocate the necessary amount of funds to bolster the public health service.
Yes, you are absolutely right. And what happens because of this is the doctors who are currently working, they are burdened with a very excessive workload.
Oh, well, in such cases, doctors are human beings. Like any human beings, they get burned out. So that means a burned out doctor is not going to deliver the same level of medical care that a well-rested one will do. So ultimately, through all this, isn't it just the patients who suffer?
Well, you got that point absolutely right, yes.
So, as medical students and as the Medical Faculty Students Action Committee, what steps would you propose as a remedy to this calamity we are going through?
Well, thank you for asking that question. We believe that the number of healthcare workers need to be reviewed immediately according to current needs. That is, a cadre revision is imminent.
Then the government will be required to admit that the no vacancy conspiracy is a lie.
Yes, absolutely. Then this baseless argument of that there are no vacancies would fall apart.
So that way, you will be able to pressure the General Treasury to allocate the necessary amount of funds to properly bolster the public health service.
Definitely. Only then will we be able to get the legal and financial provisions allocated.
So, in that vein, expediting this cadre revision is the only way that we have to enact this sustainable change that we are in desperate need of.
Absolutely. If we want to protect our healthcare service, this must happen immediately. So we believe we must unite in one voice, fight with one voice to safeguard the high quality of our free healthcare system.